Hello, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and drraghavamedicaldoubts.in. In these videos, I am providing the basic knowledge about the commonly occurring diseases for the knowledge of the general people and for basic knowledge of medicals. Today, I am going to discuss about the bronchiectasis. Bronchiectasis is defined as the condition of chronic and permanent dilatation of the bronchi or bronchioles, resulting from a complete bronchial occlusion by inflammation, mucus plaques, or foreign bodies. The portion distal to the occlusion collapses as no air enters it, and the negative pressure inside the thorax favors the expansion of the bronchi. Incomplete occlusion of the bronchi may result in obstructive emphysema, often from tuberculous lymph node enlargement or as a sequelae to pneumonia or bronchopneumonia. Clinical features. The onset is insidious, persistent coughing with foul smell, pronounced after waking, expectoration influenced by posture. The quantity of sputum is variable, and when poured and kept in a conical glass, they settle down in 3 layers. Hemoptysis, if present, confirms the foreign body being the cause of bronchiectasis. Dyspnea may occur when the disease is extensive and the general condition is deteriorated with lassitude, anorexia, or wasting. In advanced cases, there may be cyanosis and clubbing of fingers and toes. Clinical examination. Clinical examination reveals the flattening with diminished respiratory exclusion of the affected side of the chest. The trachea and the mediastinum typical impulse are shifted towards the affected side. The percussion note is dull, and the air entry is diminished with the tubular breath sounds. The characteristic leathery rails may be heard, and the vocal resonance is diminished. The developed case shows a digital clubbing, dropping shoulder and on affected side, mediastinal shift, and cavernous breath sounds, with whispering, pictorioloquy. The opposite side reveals a compensatory emphysema. Diagnosis. Diagnosis is supported by bronchography. Bronchography using a lipoidol may be necessary to establish diagnosis. In advanced cases, it helps to define the extent of the disease of planning the surgical treatment and for instituting postural drainage. Radiography. It reveals the chronic pneumonitis, mediastinal shift, and honeycomb appearance of the involved area. Laboratory data. Culture and sensitivity of the organism usually reveals a mixed flora, mainly with H. influenza. Bronchoscopy. To obtain material for culture and to find foreign bodies or distortion of bronchial anatomy. Complications. Brain abscess, emphysema, amyloidosis, and cor pulmonale are common complications. Treatment. Medical treatment, postural drainage and appropriate antibiotic physiotherapy consists of breathing exercises, general health like anemia, etc. are taken care. Surgical treatment indicated when bronchiectasis affects a few segments of a lobe and preferably undertaken of a failure of medical treatment. That's all about the bronchiectasis, and in the next video I will discuss about some other diseases. Thank you.